These are the Medicare scam calls flooding American phones right now, and they're nothing like the clumsy robocalls of the past. More than 800,000 Medicare-related scam calls have hit the country in just the past 2 weeks alone, and they're armed with artificial intelligence that can clone your voice from a 3-second recording using tools like 11 Labs or Microsoft Val-E. Here's the fundamental rule that could save you thousands of dollars. Medicare will never call you unless you call them first. Not during open enrollment, not for new cards, not for anything. If Medicare appears on your caller ID and you didn't initiate contact, it's a scam, period. But scammers have gotten sophisticated. They're not just spoofing Medicare's phone number anymore. They're creating elaborate schemes that involve fake doctors, pharmacies, and even multiple callback numbers that all seem legitimate. Take Janet from Wisconsin, who spent hours on the phone with what she thought was Medicare, her doctor's office, and her pharmacy. The scammers convinced her that her benefits were terminated and she needed to cooperate to get them restored. It was so elaborate and so tricky the way they had my doctor call me, Janet told investigators. That's really going above and beyond. The fake Medicare representative gave her detailed instructions. When the supposed medical equipment company called, she should accept a back brace, knee brace, and wrist brace. Days later, packages started arriving at her door for medical devices she never needed. This is medical identity theft in action, and it's happening to over 69 million Medicare beneficiaries nationwide. When scammers get your Medicare number, they don't just steal money. They file false claims that pollute your medical record with fake diagnoses, incorrect allergy information, and fraudulent treatment histories that could literally endanger your life when you need real medical care. The scope of this problem is staggering. Medicare loses an estimated $60 billion each year to fraud, errors, and abuse. But the 2025 numbers as of March tell an even darker story. Complaints about Medicare scam calls have surged 40% compared to last year, according to Better Business Bureau data. During the 2024 open enrollment period alone, the Federal Trade Commission reported over 45,000 Medicare-related fraud complaints, with losses exceeding $100 million. What makes these new scams particularly dangerous is the technology behind them. Artificial intelligence can now clone someone's voice using just a 3-second audio sample. In one case, defendants allegedly used AI to create fake recordings of Medicare beneficiaries consenting to receive medical products. Those fake consent recordings were then sold to laboratories and medical equipment companies, who used them to submit false claims worth millions. The callers know exactly what to say. They ask if you have Medicare Parts A and B, then claim to offer Medicare Part C, a Medicare Advantage plan, or promise free medical equipment. They might warn that your coverage could be interrupted or claim you need an updated Medicare card. Some even pretend to be calling from your doctor's office. Tim Parkey, a 76-year-old from Elk, Washington, receives 15 to 20 Medicare scam calls every single day. He can't block the calls because he needs to answer every phone call that might be from a doctor, nurse, or pharmacist checking on his wife, who's on home hospice care. Our phones are actually kind of useless, Parkey says. We don't know whether to answer them or block them or throw them away and start over. The psychological impact on victims goes far beyond financial loss. Being exploited creates shame and self-criticism that leads to severe anxiety and distress. One scam victim experienced such anger and self-loathing afterward that he had thoughts of suicide, according to mental health professionals treating Medicare fraud victims. Law enforcement is fighting back with unprecedented force. The Justice Department's 2025 National Healthcare Fraud Takedown was the largest in history, charging 324 defendants with fraud schemes involving over $14.6 billion in intended losses. That's more than double the previous record of $6 billion set in 2020. The biggest single case, called Operation Gold Rush, involved a network that used foreign straw owners and encrypted messaging to buy dozens of medical supply companies across the United States. They submitted $10.6 billion in fraudulent claims using the stolen identities of over 1 million Americans from all 50 states. The scheme was so massive that Medicare was scheduled to pay out $4.45 billion before investigators caught it. These operations often involve durable medical equipment fraud, where scammers bill Medicare for wheelchairs, oxygen equipment, and braces that patients never requested or received. The dark web fuels these operations. Medical records are among the most valuable assets sold there, and criminals are harvesting personal information to create increasingly sophisticated scams. According to Experian, complete medical records fetch premium prices because they contain everything scammers need to file fraudulent claims. Caller ID spoofing makes these scams nearly impossible to detect by phone alone. Scammers use technology to make Medicare's actual name and phone number appear on your caller ID, even though they're calling from overseas or from criminal operations. The Federal Communications Commission reports that most scam calls show local area codes, but they're likely not originating from those locations at all. The scams have distinct patterns. In new card scams, callers claim Medicare is issuing updated cards with new security features and need to verify your identity first. Benefits cancellation scams create urgency by claiming your Medicare account has fraudulent activity, and benefits will be canceled unless you verify information immediately. Refund scams promise Medicare rebates that require bank details to process. Free equipment scams offer special deals, lower premiums, or limited-time benefits in exchange for switching plans. What scammers can do with your Medicare number is terrifying. They can access medical care under your identity, get prescriptions, file insurance claims, and saddle you with bills for services you never received. You could face charges for treating conditions you don't have, calls from debt collectors about medical debts you don't owe, and notices that your benefits are maxed out. Worse, false diagnoses and incorrect medication information in your record could delay or block legitimate care when you desperately need it. Gerald Montgomery had to get rid of his phone entirely because scam calls were so constant. I mean, 1 out of 5 phone calls were a scam, he said. And now it's switched over to where it's 4 out of 5. Protection starts with skepticism. Don't answer calls from unknown numbers. Never give out Medicare numbers, Social Security numbers, bank information, or personal details over the phone. If someone claims to be from Medicare or your insurance company, hang up and call back using the official number from your Medicare card or the 1-800-MEDICARE hotline. Create a family code word for emergencies. With AI voice cloning becoming common, establish a unique safe word that only your family knows. If someone claims to be a family member in an emergency, ask for the code word first. Don't use street names, pet names, or anything that could be found online. The AARP Fraud Watch Network provides additional resources for protecting seniors from these sophisticated schemes. Their free alerts and educational materials help millions of Americans recognize and avoid Medicare fraud before it happens. The government is creating new weapons against these scams. A healthcare fraud data fusion center is being established to bring together experts from the Justice Department, FBI, and other agencies using cloud computing, artificial intelligence, and advanced analytics to identify emerging fraud schemes before they can steal billions. The Senior Medicare Patrol Program has 54 projects with over 5,600 active team members conducting more than 22,000 outreach events annually. In 2024, they helped identify fraud that led to nearly $35 million in restitution from just one doctor who was signing orders for cancer genetic testing and medical equipment without ever seeing patients. If you suspect Medicare fraud, especially involving claims over $1,000, call 1-800-MEDICARE immediately or report it online at medicare.gov/fraud. You can also contact the Office of Inspector General hotline at 1-800-HHS-TIPS. For Medicare Advantage or drug plan fraud, call the Investigations Medicare Drug Integrity Contractor at 1-8777-SAFE-RX. State health insurance assistance programs in each state also provide local support for fraud reporting. The Wisconsin Senior Medicare Patrol emphasizes a critical truth. Medicare doesn't take away anyone's benefits. and Medicare will never contact you unsolicited to ask for your Medicare number or personal information. Any unexpected call claiming to be Medicare is a scam designed to steal your identity, your money, and potentially your health. The Medicare call that isn't really Medicare is now the most expensive phone call Americans never asked for. But knowing that Medicare never calls first gives you the power to hang up and protect yourself from becoming the next victim in this multi-billion-dollar fraud epidemic targeting Medicare, the federal health insurance program administered by CMS serving over 65 million Americans.